All right, guys, I guess we'll go ahead and get started. Um, I want to thank you all for coming today. This is going to be the Cigna IFP or Individual Family Plans presentation for open enrollment for 2025. My name is Dennis Pujals. I am the broker manager for Florida. I run the whole state. Been doing it for a little while. Been with Cigna now for about 2 years. Prior to that, I was with another carrier, but running the state since the beginning of open ACA, I should say. So I've always run the whole state. If you need any information on any parts, any counties throughout the whole state, even competitive information, sometimes I can go ahead and assist with that. Pretty familiar with what's going on out there. So let's go ahead and see what's different about Cigna. So what makes Cigna different? Well, we've always, our brand name is pretty recognizable. So we've been around for a very long time. We've had a very good reputation for a very long time. In fact, that very long time, Cigna's been in business for over 232 years. So it's been, like I said, longevity is huge with us. We are in 30 countries right now, and we actually have networks in over 200 countries throughout the world. But of course, we're going to focus on the United States, which is our number one. That's where we are. We're going to focus on that. So due to our size, we are very financial stable as well. We are ranked number 16 on a Fortune 500 list. And if you've noticed the landscape of the industry over the last few years, there's been a lot of financial instability with certain carriers out there. So um, we just want to make sure that we're not going anywhere. We're in a good position financially, and we're looking still to grow. That being said, we've also always been known to have a very strong provider network. Just in South Florida alone, just give you a couple names. We do have Baptist in our network. We have Cleveland Clinic, Children's Hospital, the Nicholas Children's Hospital, Jackson's. We do have very good provider networks, so that helps us keep the quality of service that you and your members are always looking for. So go ahead. Some of the things that for our members to add some member value. So every member that we have with Cigna has access to their own member portal. Now they can do it through mycigna.com, or there's a MyCigna app that they can download either through their iPhone, their Apple products, or even Android products. Once they register with their information, make sure that the members use their email address. It's because you can only use one email address one time. So if they have their information, once they log in, they're going to have access to a bunch of tools at their fingertips, basically. So they're going to be able to find provider care and the costs associated with whatever the visit's going to be. If it's a certain procedure, they could show the costs on their website as well, on their member portal as well. They're going to be able to view all the claims that they've gone through to make sure everything's accurate. They're going to be able to make payments online. So any monthly bill, they can set up auto pay through the MyCigna app as well. And of course, they're going to have access to their digital ID card. For every new member, they're going to have an ID card sent out to them. But renewal members, we don't send out new IDs. Now, a member could always request one, but they're always going to have access to a digital version. And of course, they're going to be able to print that ID card out if necessary. Okay. So let's keep on going. So we do have our virtual care, and we use MD Live. So MD Live is one of the top providers out there for virtual care. Basically, it's 24 hours a day, 7 days a week, 365 days a year that they can utilize this service. The coverage, it can be used for urgent care visits. I mean, of course, you can't go and they can't check you out personally, but anything urgent that you can, and once it's registered, the members will be able to see someone live within minutes and have whatever needed, whatever taken care of or seen at least by a provider, a doctor, they can have it seen immediately. You can actually set up routine visits. So if you want a routine visit to have checkups with certain providers, you could set that up. And they could even do some services, primary care services, meaning set up for preventative labs or even prescription refills. Or if they need a referral, they can go ahead and request a referral. Now, we are an EPO, meaning it does have to be in our network, but you don't need referrals to see specialists. You can go see a specialist, or you don't need to see the PCP without you don't have to see one to get a referral to go see a specialist, in other words, but it is recommended to do so. Other additional coverages on specialists through virtual care is our dermatology. So if they have some irritation on the skin or something, they can actually see, someone can see it live and recommend what they would need to do. And over the last few years, of course, behavioral health has been in the forefront of uh, of what members are looking for. They have access to behavioral health through either mental health counselors or therapists or even psychologists through the behavioral health through virtual care. Okay, so our pharmacy resources. So we use Express Scripts. Express Scripts is part of the Cigna family. So Evernorth, Express Scripts, Accredo, it's all part of the Cigna group. So we utilize them. It's a very, I'd say probably the easiest way to manage your pharmacy, pharmaceutical needs. So basically, they will deliver it to your house. It's incredibly easy. I use it myself. I don't have to worry about going and getting a refill, going to the pharmacy. They have it scheduled to come to my house with a refill. So it makes it convenient. It's very easy to use. If you need some type of specialty pharmacies, like other tiers or different types of, I guess, higher prescriptions, we do have Accredo by Evernorth. They are basically, they can help out with any aspect of the pharmacy that you need. So if it's a higher tier, let's say tier 3, tier 4 type of medication, they can explain what's in it. They can walk you through it, how to utilize it. Basically, anything that you need when it comes to prescriptions, Accredo can help with that, and we can send you there. Sometimes you might need to refill a prescription immediately, and you can't wait for it to be delivered by a Express Scripts. So we do have our Walgreens Advantage network. It's available across the U.S., except for Texas and Virginia. I believe we use CVS in those. If not, but we do have also thousands of smaller pharmacies that are contracted with us, our providers nationwide. Of course, we try Evernorth pretty much runs our PBM, our pharmacy benefits management. They basically try to make sure that they're ensuring that we get the lowest costs or the affordability for the members so they can afford these prescription drugs. Now, if you want to see what is available per plan, you can go to Cigna.com, and check our formulary. You put in the plan that you're looking for, and it's going to display all of the any medication you're looking for. It'll tell you the tier that you're looking for and the costs associated with it. Okay. All right. So this is our rewards and discounts plan. So our member rewards plan or our customer loyalty rewards plan is our Cigna Take Control rewards. So our members can earn up to $325 per annual year. Um, so it's very simple to earn points too. It's they can just go to the PCP and they'll be able to earn $100 for visiting the PCP. They can take a 3-minute survey, an HRA, basically a health risk assessment, and that'll give them $75 there. And then there's other activities that they can do to earn more points, and which you can change for more dollars on it. Now those points can be exchanged for different experiences. I'm not sure which ones, but the experiences you can change for merchandise, meaning hats, shirts, whatever you want, or you can actually have it loaded onto a rechargeable Visa debit card. Okay, so they can use that for whatever they want. Now, one thing that's changed this year, the points are rolling over. So if it wasn't utilized last year, they can actually roll it over to this year. So if they had $325 last year and they got $325 again this year, you could add up to $650 for them. And now say you can use that for whatever they want because it's on a rechargeable card. If they want to pay the premiums, if they want to do something else with that, they can go ahead and do so. Now we also have our Healthy Rewards discount. So the Healthy Rewards discount is basically a deep discount plan for our members. It will give them discounts on gym memberships. It says specialty provider discounts. What that is, there's healthy like technology, smartwatches, other things to that nature that they can go ahead and get discounts on for for being a member. They can get discounts on hearing exams or even hearing aids or even with our save with our Cigna Vision. Okay. One thing that we do have, our member service, it's trained they're trained a little bit different than the other carriers. So we call it our Signal One Guide. What they do is they're trained to basically handle all departments, all aspects of the healthcare. So they want to take the members from point A to point Z. They can handle pretty much anything in between. So by calling 866-494-2111, basically they will be able to walk you through, like I said, all parts of it. If you need to find a provider, they can assist you with that. If you need to find, or if you want to review a bill and understand what the claims are or what the costs are associated, so you can avoid being charged unexpected bills. They'll tell you what is covered on your bill, in other words, or on your policy. You can manage diagnoses, basically understand the plan benefits that are associated with your policy. And of course, if you need anything to learn how to navigate through either our take control plans or reward cards or reward discount plans, they'll go walk you through the My Cigna plan or the member services or member portal, excuse me, as well. So let's go ahead and talk about our footprint. So in 2025, we're going to be in 11 states. I do need to mention that we are exiting 3 states. We're in 14 states last year. We exited Utah, South Carolina, and Pennsylvania. We want to make sure we're focusing on these 11 states. Now, those 11 states are going to be Arizona, Colorado, Texas, Mississippi, Illinois, Indiana, uh, Tennessee, Virginia, North Carolina, Georgia, and of course, the best one, Florida. So since speaking about Florida, let's go ahead and talk about Florida. So Florida, we offer plans in 11 counties throughout the state. I do got to mention, we did exit Leon County. So unfortunately, there was about 25 members that we had there. We're not going to be offering services to them. It's not too many, but we wanted to focus on the plan, on the counties that, uh, we're trying to focus on these counties. We're looking to expand in the next year or so. So look forward for that pretty soon. But right now, we're offering services in Broward, Collier County, Indian River, Lake, Martin, Miami-Dade, Orange, Osceola, Palm Beach, St. Lucie, and Seminole counties. So a lot of those are in the Treasure Coast, we've been extremely competitive there over the last couple years. I still believe we're going to be extremely competitive there as well. You might want to look for that. But we do have on and off exchange plans available for basically in the state. So if you need an off exchange, we do have a silver plan there you can offer throughout the state. All right, so product portfolio. So there were some changes done this year by CMS that they actually standardized a couple plans. So we're incorporating these plans in here, but we're going to be offering 11 total plans this year in Florida. So 4 bronze plans, one of those bronze plans will be a standardized CMS standardized plan. We also have an enhanced diabetes plan in our bronze offering. So that enhanced diabetes plan basically is for our diabetic members that they'll be able to have better pricing on insulin or the medication they needed, plus the copays when they're seeing their specialist, the gastroenterologist. The gastro. So basically, you can offer. That's a great plan for our diabetic members. Now, the silver plans, we're offering 3 on exchange and 1 off exchange. Now, 2 of the 3, honestly, are CMS standardized plans. So that is going to be the same plan design across the table with all carriers. So it's not just going to be Cigna, it'll be all of them. And then we do have another plan offering as well on the silver side. And of course, gold, we do have 1 CMS standardized plan and 2 other gold plans available. Now, one thing you'll notice when you're looking at the formularies for standardized plans or non-standardized plans, standardized plans, you're going to notice the different tiers of formulary, meaning the prescription drugs. A standardized plan is going to have 4 tiers, and the normal Connect plans or Cigna plans will have 5. Okay. So all these plans, of course, as I mentioned, we're an EPO. So you do not, it's the PCP is encouraged because they can help manage the health of your member to make sure they're making the right decisions. They don't need a referral to go see a specialist, but honestly, I've done this in the past myself. I could self-diagnose myself and I got to go see the specialist. Well, I wasted money by going there because it turned out I didn't need to see that specialist and it was a higher copay. But that's why the PCP could have helped out. But once again, it's not mandatory, it's not required, but it is recommended that you go see the PCP before your specialist. And I can say pretty much every person, all the people that work in all the specialty offices, they're always asking for a referral anyway. So might as well get it, but it's not necessary. Um, this year, pediatric dental is available on exchange. That's through the CMS, the standardized plans. That's a little bit of a change from last year. This year also, we have $0 medical plans, $0 deductible plans, pretty much on every tier. And from bronze, silver, and gold. They're all going to be available. And I already mentioned the enhanced diabetes plan for a bronze plan. Okay, these are some of our key partners. As I mentioned, we've always had a very strong provider network. Baptist Health, of course, Cleveland Clinic, Holy Cross, Jackson. We have Memorial Healthcare, Health Systems. We have Mount Sinai, and in Orlando, we have all 12 of the Orlando Health hospitals. This is not all of them, but this is a good. These are some of our top ones. I always like to point out Cleveland Clinic. Not everybody's always wanted them here in Broward County, but that's not Broward County. They're great with us, but also in the Treasure Coast. They are the premier provider in the Treasure Coast up there. So if you're from there, if you have members there, that's a key hospital to get them for the members in that area. I see a couple of pictures. Okay, we're good. All right, I just put this out just as a couple examples of some of our selling our better plans from last year. So our we do have a zero deductible bronze plan, which is like one of our most competitive on the bronze side. So basically, it has low copays. It's got good costs associated with it. I did put the bronze 5,500 deductible plan as well. Not everybody qualifies for all the subsidies, so that is a competitive plan for someone that wants some type of coverage. And our probably most competitive plan out there is our Connect, Silver Connect for a $0 individual deductible plan. So it's a silver. Of course, with silvers, it always depends on the income level of the members. But if they qualify for this one, it's the most competitive one we have. No deductible, a very low max out of pocket, $0 copays, $5 per specialist copay, and it's on and on. Even the prescriptions, the copays for prescriptions are extremely low. So well, those are some of the best plans. Of course, there'll be some others out there, but I just wanted to point some of those out. All right, so we do offer our dental product across the board in pretty much all all states, in all states, including Washington D.C., except for Massachusetts. That's the only one we don't offer dental in. Now you'll notice that we do have the blue plans. That's more of our basically traditional dental plans that have been offered to all the members. We do have the orange plans and the green plans. If you want to look into it a little more, basically some of our plan designs and our benefits here. The most common one, of course, sold is this one here, our Cigna Dental 1500. This one does cover some type of orthodontics in there. Most of the time, these covers, the others don't, and most dental plans associated with ACA products they don't cover orthodontia. So this will cover some for orthodontics. Plus, you can have a child only plan. It has no age restrictions. You can go all the way up to whatever age it is. I'll probably get to it in a second. Give me a second. So basically, yeah, if you're looking at these plans here, we also that's the blue plans, our normal low deductible plans. We are a PPO network, a DPPO network. So we do have some out of network. I guess there are some providers that will do it. Of course, the discounts that are associated with that are a little less. It's always better to go in network, but we do have it's a DPPO, so you can be outside. We do have about 6,500 doctors or providers in our network, so it's a very strong network. A lot of the other competitors, what they'll do is they have access points. So you might have one doctor working in 5 different places. They count that as five. Now we have 6,500 competitive or actual providers in our network, so it's extremely competitive when it comes to that. Now, we also offer plans that have dental, vision, and hearing associated with it. So the most common one that you'll see is actually this one, our best seller. You see these are the average prices. It's not any one specific, but you can see the higher the amounts go, the better, or the more the premium goes up, but it's very competitive price wise. So you'll notice that there's a 2,500 dental benefit for our 3,500 plan. One thing it does also cover and offer. Most of these plans they will cover, let's say, a crown being put in, but they will also there's a couple different parts for the implant part. So the metal part that goes into your jaw, that can also be covered on the 3,500 plan. Plus, when it comes to, let's say, the hearing portion of it, this has a $700 hearing allowance per the exam as well. And our vision, we do have a $300 material allowance annually. So actually, if you start, let's say, you can write this any time of the year. Every January 1st, it replenishes the amounts that are being used. So let's say you start in July and you let's say get glasses. Well, you have the $300 allowance for the materials. Then when January 1st comes around, you're going to have another 300. So it's done every year. I use glasses. I know I have to wait every 2 years usually. This is a 1 year thing. Now, one thing I do like to let everybody know is if you're appointed with Cigna IFP for medical, you're already appointed to sell the IFP dental. Most people don't know that. If you're licensed in any state, you can do that also. And another thing is it doesn't matter since we don't bundle this with our medical product. You could sell this to anyone. You could sell it to a Medicare patient. You could sell it to another carrier. So if you sell it, let's say with I don't know any other carrier that you've seen here today, and you don't like their dental product, you can sell the dental product, our product, to their and it would be separate from their ACA or IFP product. So, excuse me, do not need Social Security. I mean, basically, it's completely separate. Meaning, if it's a Medicare or anything like that, no, so you could sell it separately. So, excuse me. So waiting times, if it comes from a larger carrier that you've had that waiting time there, a lot of times it will transfer over. So as long as you had major medical, it's now certain waiting periods, it is subject to some waiting, but for the most part, if you were with, let's say, on a group plan and you had a carrier for a couple of years and you already went through that waiting period, it can transfer over. Okay, so as I mentioned, if you're appointed already with IFP, you're appointed already with this. And I can tell you the commissions on this, first year is 20% of the premium. Every other year will be 10% of the premium. So as long as you're licensed in the state, you can offer it. Okay? And bear with that. All right, so let's talk about what the brokers get. So once you're appointed as a broker, you're going to have access to our Cigna for Brokers, basically broker portal. Okay. We've done a lot of upgrades to this portal this year, so but you're going to have access to a lot of reporting. So if you need to see your book of business, you can go ahead and see it. If you're appointed directly with Cigna and you receive commissions directly from us, you have access to your commission report. If you're under an agency, of course, that they're going to have access to, and you would have to get commission reports through the agency. But we do have access to a resource center if you need marketing materials or anything. We'll get into that in a second on a different slide. And then here is where you would enroll either the medical or the dental. So let's go ahead and take a look at it. So we have, when you log in, you'll be able to see if you're trying to enroll a dental patient or member, then you can go into our Express app. Basically, we've done a lot of upgrades there as well. So you could compare plans. You can give them quotes, and of course, you can enroll through them. Now, you cannot enroll any of our dental plans through the marketplace. Okay, it has nothing to do. It's not bundled together. All right. This is through the broker portal. So if you there are carriers out there that will put their dental into their medical plan, and they usually don't pay commissions for that. So that's not what this is. So you can sell anybody to the marketplace on another carrier or even with us, and then you can sell them this one through the portal. Okay, through our Express App portal. If you're looking for medical, for quoting, for anything on the medical side, you go through we go through our portal. It takes you to Health Sherpa. Now, our version of Health Sherpa will not show anybody else. So it's only going to be Cigna. And if you're going to enroll someone that's not on the marketplace in the exchange, you would have to enroll it through here. If you go directly to Health Sherpa's outside, if you're directly to the Health Sherpa, you won't be able to enroll an off exchange member through the portal. It'll have to go to the marketplace. Okay. But we do have some updated and advanced, I guess, features that'll show basically all our plans. Like I said, you won't see any other carrier if you go through this one. Okay. All right. So some of the new things that we did this year, we did some upgrades. So one of the things that we heard the member or the basically agents and agencies were complaining about is they wanted more data. So we added or on our book of business and to our commission reports, we're adding more unique identifiers, meaning subscriber ID on there or other gets payment information, some other things too there so that you can actually compare the book of business to any other reporting system. If you have a CRM or another type of enrollment platform, now you'll be able to compare it to be able to find your members easier, especially with all the fraud that's been going on over the last couple of years and all the members been taken. This way you could stay on top of your member to make sure that the members are yours, you're in what good standing, so you're staying on top of your members. Of course, if you're not paying attention to your members, someone else is. So, and they're going to be taking it. So this is a good way to do it. Another feature that we're upgrading is the ability to make the binder payments at the time of enrollment. So that's a feature that we've never been able to do. We were trying to get it installed for last year, didn't have it in time. Now we've been testing it with certain agents and agencies for the last couple months, and it's going to be available for all agents on November 1st. So the second that happens, we're going to give everybody access, and you're going to be able to make the binder payments for the members at the time of the enrollments. Okay, one little change. That's a bit of an upgrade. One thing we've been hearing, and it's not available yet, but it's coming soon, is the ability to print ID cards through the portal too. So that one, we're expecting it the second quarter of next year. It's not as easy. It's a big lift to be able to make some changes like that, but that is one of the things that we've been working on to make it available for you. Okay. All right, I mentioned earlier also on the portal, you can click resource center. So by clicking the resource center, it's going to have a lot of tools at your fingertips as a broker. So basically any material or resources to learn about any medical plans, meaning summary of benefits or anything on the plans, you're going to have it there. You can click on marketing materials, so flyers. If you want to give some flyers to your members, or if you need any additional information, you can have it here as well. There's going to be training, on-demand training videos. So if you need to learn how to use the MyCigna or Cigna for Brokers or MyCigna member portal, or even how to enroll, let's say using Express app or Health Sherpa, you're going to have videos on how to utilize all our systems. So it's going to any training on demand, you can have it there. Of course, you can call me. I'll help you out with that too. But you have it here without having to call me. And if you need to send out any, let's say, emails to your members or social media, this has templates that you can use with already approved logos that you can utilize when you're sending to your members. Okay, especially with the way CMS is looking at everybody. I'm sure you heard what they were saying today. You want to make sure everything's compliant. Now, these have already been approved by our legal team, so you can go ahead and do that. Okay, want to make sure you're in good standing. All right, so that's the Cigna for the Resource Center. All right, so very important dates for you to know. Of course, November 1st is when this all gets started. So anything from the open enrollment will be open from November 1st all the way to January 15th. Now, any members that are enrolled between November 1st and December 15th will have a January 1st, 2025 effectuation date. Okay. If it's enrolled between December 16th through the January 15th, then it's going to be a February 1st effective date. All right, so just make sure you're aware of that. Every year it's changed a little bit here and there. At the beginning, it all went all the way to March. Then it stopped. It was all the way only till December 15th for about 5-6 years. Now they expanded it last year to January 15th. So just make sure you're aware of that. And I know it overlaps a little bit with Medicare if you're doing Medicare on that side. But good dates to know. All right, some contact information. So as I mentioned, we do have Cigna for Brokers. That is the website right there to get access to your broker portal. Our broker support, very simple to remember. It's 877 Cigna 15. What that is, it take you to our dedicated broker support for you. They're going to be open Monday through Friday, 8 a.m. to 8 p.m. So that's general hours. So they're going to be always available. If you want any general inquiries or questions, please Cigna sales at Cigna-isg.com. You have any commission questions, you could send it right here as well. IFP commissions at Cigna.com. So medical are, as I mentioned earlier, our member services or our one guide is right here, 866-494-2111. Now we are, as I mentioned, we're around the world. So this is basically, you have 24, they're available 24 hours a day, 7 days a week, 365 days a year. Now we're all over the place. Like I said, we have call centers in the US, we have call centers in India, we have call centers basically everywhere. So you will be able to get in touch with someone. Now, some quick links if you want to be able to get to somewhere fast. You have for individual payments. Now, you as a payment through the portal, you have access for the binder payment. But after that, you're not supposed to house that information anymore. Now, if you need to help assist your member with a one-time payment, this is the link you can go to, cigna.com/IFP-payment. Anything with brokers, you could go here, the drug list or formulary, any provider list, or even any information on IFP plans. Now, that being said, I don't think you're going to remember all that stuff. The easiest way to do it is go to Cigna.com. Go to Cigna.com and you have links to get to all of that. So our formulary, you can get to the broker portal, you can get to everything. All right, it makes it a little bit easier going that way. But in addition to that, you have me. So this is my contact information. Now, I am, I guess, the subject matter expert for Florida. I could tell you all the ins and outs for Florida, all the counties, pretty much the competition, what's going on with everybody. Now, I do have some information about the other states as well, but I'm not an expert in all the other states. So I do have my counterparts that are experts in their areas as well. So if you need any assistance getting for any other states, I can try to answer it as best as I can, or I can put you in touch with them that they can help you out. So now we've gotten to the end of our presentation. Thank you, but now do we have any questions? And I'll actually go back and leave this up. So